Now we complete our talk about the clinical presentation of patients with liver cirrhosis. As you can see here, this is a jaundice patient with yellow discoloration of the sclera, which is a commonest presentation, jaundice. And the most important actually in liver cirrhosis is the stigmata of chronic liver disease. Stigmata of chronic liver disease. Commonly patients present with muscle wasting. You may have scratch mark, itching, especially when there is cholestasis. You may have pallor, anemia, when there is loss of blood, for example due to esophageal varices or due to peptic ulcer disease. You may have jaundice. You may have parotid enlargement, xanthelasma, lipid deposits, clapping of fingers is very important in chronic liver disease and liver cirrhosis. Palmar erythema, duptrine contractures, spider nevi or angiomata, petechia and purpura due to bleeding tendency, decrease in the body hair, gynecomastia, testicular atrophy مثل ما قلنا هنشوف أكثر شيء بالالكوليك liver disease, parotid enlargement, duptrine contractures, spider, petechia, decreased body hair, and gynecomastia with testicular atrophy are commonly seen in alcoholic liver disease. Caput medusa in the abdomen. You may have edema with ascites. Splenomegaly is very common, especially with portal hypertension. Asterexis and flapping tremor with fetor hepaticus. So spider telangiectasia is important to be noticed in patients with chronic liver disease, and it is comprised of a central arteriole, feeding arteriole, which occasionally raises the skin surface, usually raised, from which small vessels radiate. They vary in size from 1 to 2 centimeters in diameter, variable size, high spider telangiectasia, and are usually found in above the nipple, upper part of the chest, above the nipple, the neck, even you could find in the neck and even in the face. 1 or 2 small spider telangiectasia may be present in about 2% of the healthy people. إذا ممكن نلقي واحد أو اثنين، بس إذا أكثر no. This is commonly a features of liver cirrhosis and may be occur transiently in greater number in the third trimester of pregnancy. عادة بالثird trimester of pregnancy نشوف spider telangiectasia وحتى نشوف palmar erythema. But otherwise they are a strong indicator of liver disease. This is a spider telangiectasia. This is the central feeding arterioles, and this is the small arteriole radiating here. This is spider. As you can see here, this is the spider nevi. شوف من نضغط بالslide with the pressure, we are going to press on the feeding central arteriole هذا، وبعد ما نرفع راح يرجع. This is characteristic way to examine for spider nevi. اما نضغط بالslide او نضغط by يعني tip of the pen او راس قلم مثلا، او حتى by your finger. You can press it by your finger.
This is a spider nevi.
So this is a spider nevi, and he is compressing. It's very clearly obvious after you remove your fingers. راح نشوف شلون ترجع السبايدراية. This is a gynecomastia, a patient with liver disease showing enlargement of the breast. طبعا احنا بنشوف patients عنده gynecomastia وهو cirrhotic. فأما due to alcoholic liver disease اللي could present with gynecomastia، أو ممكن واحدة من line of treatment of those patients نعطيهم احنا spironolactone اللي هو الالدكتون. فأيضا الالدكتون يسوي لنا gynecomastia. فالgynecomastia here both could be due to alcoholic liver disease per se, or could be due to management of the disease by spironolactone. Palmar erythema can be an early sign in the chronic liver disease. مثل ما قلنا احنا البالمر erythema نشوفه هنا هواي. ايضا نقدر هنا نضغط ونشوف ايضا when you press on the erythematous area here. بعد ما نرفع اصبعنا راح يصير عندنا return of the redness يصير بالمر اريثيما بالبريجنسي نشوفها بالروماتويد ارثرايتس، نشوفها بالكرونيك ليفر ديزيز، نشوفها ايضا بالثايروتوكسيكوسيس. This is distended abdomen ascites ايضا يصير بالchronic liver disease. And you have many causes for why patients with liver disease have ascites, due to portal hypertension, due to decreased oncotic pressure because of hyperproteinemia, due to retention of fluid and sodium, secondary aldosteronism, splenomegaly and collateral vessels. ممكن نشوف هنا الكبت ميدوزا مثل ما قلنا. Collateral vessel formation are features of portal hypertension which occur in more advanced disease. So this is cytic fluid accumulate. This is distended abdomen with gross ascites. Evidence of hepatic encephalopathy also becomes common with disease progression. Non-specific features of chronic liver disease include clapping of fingers, very important, clapping of fingers and toes, and dupuytrenine contractures. راح نشوف هسه صورة للديوبترين contractures اللي نشوفها أيضا بالalcoholic liver disease. Chronic liver failure develop when the metabolic capacity of the liver is exceeded. It is characterized by presence of encephalopathy, easy bruising and become more frequent as cirrhosis advances. أيضا easy bruising because of the decrease طبعا بالcoagulation or clotting factors because of the impairment of liver functions. Other clinical and laboratory features may be present. These include peripheral edema, renal failure, jaundice, hypoalbuminemia, and coagulation abnormalities due to defective protein synthesis. This patient showing white nail leukonychia, white nail due to hypoproteinemia. This is palmar erythema, very obvious palmar erythema. This is clapping of fingers, and this is dupuytrenine contracture. Show fibrosis here, dupuytrenine contracture. This video showing very obviously a patient with chronic liver disease, and he got dupuytrenine contractures. نشوف هنا الفايبروسيس، هاي الفايبروسيس، this tendon fibrosed with flexion. طبعا راح يصير عندنا flexion بالlittle and ring fingers here, flexion due to dupuytrenine contracture seen in alcoholic liver disease. طبعا هذا البيشنت ايضا عنده clapping of fingers اذا يعني هو البيشنت عنده clapping of fingers as well. In summary, regarding clinical features of liver cirrhosis, mainly you will have hepatomegaly, although liver may also be small given that are infectious causes. You may have jaundice, ascites, spider nevi, palmar erythema, cyanosis as well, endocrine changes, loss of libido, hair loss. In men we could have gynecomastia, testicular atrophy and impotence. In women we have breast atrophy, irregular menses and amenorrhea. Hemorrhagic tendency, bruises, purpura and epistaxis, certain bleeding tendency. Portal hypertension راح يسوي لنا splenomegaly, collateral vessels اللي هو الكابت ميدوزا, and even variceal bleeding. لذلك دائما احنا نسوي لهم لازم endoscopy to exclude esophageal varices as a major and important cause of upper GIT bleeding. Hepatic or portosystemic encephalopathy and other features like pigmentation مثلا in hemochromatosis or other feature in other cause of cirrhosis أيضا يصير عندهم generalized hyperpigmentation, digital clapping and dupuytrenine contractures. Features of chronic liver failure. Liver failure may have worsening synthetic liver function, so he will have prolonged prothrombin time and hypoalbuminemia due to decreased synthesis of protein and decreased synthesis of clotting factors with vitamin K dependent factors mainly. فيصير عندنا prolonged PT ويصير عندنا hypoalbuminemia. You may have jaundice with portal hypertension. portal hypertension طبعا يسوي لنا variceal bleeding, يسوي لنا hepatic encephalopathy, ascites, and with ascites it may lead to spontaneous bacterial peritonitis and hepatorenal failure. إذا أهم شيء حقيقة بالنسبة لنا نحفظها هي الاستجماتو of chronic liver disease اللي هي mainly spider nevi, palmar erythema, gynecomastia, dupuytrenal contractures, parotid enlargement, testicular atrophy, decrease in the axillary and pubic hair, and eye signs يشبه الهايبرثايرويدزم. ممكن حتى يصير عندهم اكزوفثالموس. هاي هي الميل الكمان اللي نشوفها بالاستجماتو of chronic liver disease. But other features of stigmata of chronic liver disease أيضا ممكن نلقيها. How are you going to manage a patient with chronic liver disease or liver cirrhosis? So you have to treat the underlying etiology, alcoholism, hemochromatosis, Wilson disease. You have to maintenance of nutrition is very important. Treatment regarding nutritional issue, because an important cause of liver cirrhosis is alcoholism, and usually those patients have poor nutrition, and you have to treat the complications. So you treat the underlying etiology, you have to improve nutrition, you have to treat complications. Complications هي دائما تجينا من البورتال hypertension اللي هي الاسايتس والهيباتيك انكفالوباثيز, البورتال hypertension, esophageal varices. Once the diagnosis of cirrhosis is made, طبعا لازم احنا نسوي endoscopy to exclude esophageal varices لأن important and serious causes of upper GI bleeding, and you have to perform a screening for esophageal varices and repeated endoscopy every 2 years. As cirrhosis is associated with an increased incidence, راح نشوف انه major complications of liver cirrhosis هو 2 portal hypertension and hepatocellular carcinoma. إذا those patients اللي هم cirrhotic patients يراد لهم regular surveillance looking for the important complications and sequelae of chronic liver disease and liver cirrhosis اللي هو hepatocellular carcinoma. Chronic liver failure due to cirrhosis can be treated by liver transplantation. The overall prognosis in cirrhosis is poor. Many patients present with advanced disease and or serious complications that carry a high mortality. إذا البروجنوز عندنا دائما poor. احنا مثل ما قلنا irreversible damage to the liver with chronic fibrosis and loss of normal liver architectures with its complications, mainly portal hypertension with sequelae mild portal hypertension, and later on he may have hepatocellular carcinoma. إذا البروجنوز دائما poor بالliver cirrhosis, and many patients present with advanced دائما يجون هذول advanced liver disease or complications of liver disease, chronic liver disease. It carry high mortality. Overall, only 25% of patients survive 5 years. Generally speaking, 25% of them he may survive up to 5 years. But for the diagnosis, where liver function is good, 50% may survive for 5 years and 25% for up to 10 years. The prognosis is more favorable when the underlying cause can be corrected. إذا treatable condition مثل Wilson disease, hemochromatosis, مثلا abstinence of alcoholism, he may have some good prognosis as an alcoholic misuse مثلا أو hemochromatosis or Wilson disease. Deterioration of liver function as evidenced by jaundice, إذا لا صار عنده severe jaundice, ascites, encephalopathy, هذا indicate poor prognosis unless a treatable cause such as infectious is found. Increasing bilirubin, falling albumin, طبعا من يصعد لنا الجوندس يقل لنا الالبومين، طبعا هاي كلها indicate marked hyponatremia not due to diuretics. طبعا diuretics هم يسوي لنا hyponatremia، هم دول كلهم ياخذون diuretics، بس إذا كان عندنا marked hyponatremia not due to diuretics، prolonged PT، كل هاي bad prognostic features of chronic liver cirrhosis. Renal functions may impair، يصير عندنا liver renal failure. It is known to be poor prognostic features in end-stage disease. The course of cirrhosis can be unpredictable، فدائما يعني الكورس مال liver cirrhosis هو unpredictable. ممكن يكون survive، ممكن mortality is very high. As complications such as variceal bleeding may occur. طبعا إذا دخل esophageal varices severe upper GI bleeding طبعا very risky situation. فإذا نرجع complications of liver cirrhosis mainly portal hypertension and hepatocellular carcinoma. portal hypertension and its complications. من صار عندنا portal hypertension راح يصير عندنا esophageal varices, gastric varices, esophageal varices, congestive gastropathy, hypersplenism, splenomegaly with hypersplenism, ascites, iron deficiency anemia because of blood loss, renal failure, and hepatic encephalopathies. All are a sequelae and the complications of portal hypertension. The second important complications of liver cirrhosis هو hepatocellular carcinoma. And thank you.